Welcome to the Dr. Coffee Podcast. My name is Simon, and today we have got two special guests in studio for this video episode of the podcast, your weekly blend of motivation, encouragement, education, and insight into all things medicine for junior doctors and medical students in South Africa. Today we're discussing the Philips Future Health Index report for 2023, specific to South Africa. And with me in studio, I've got Dr. Nokukhanya Khanyile-Lenake,
yes,
as well as Mr. Romulen Pillay. I'm going to introduce both of them, but before we go any further, I want to remind you that you can download the Future Health Index report for yourself to go through all of the findings from this report and apply it to wherever you find yourself in the healthcare sector in South Africa. Dr. Nokukhanya Khanyile-Lenake is a registrar at the WITS Health Circuits in pediatrics. She's almost finished her registrar time. She's also a proud mom, and she's vocal about healthcare access and equity in South Africa. She's developed, I would say, an enormous following on Twitter and Instagram because of the way that she's been advocating for better healthcare services in South Africa, as well as mental health and underserved communities in our country. Then on our right is Mr. Romulen Pillay. He's the managing director of Philips Southern Africa, and he's very interested and involved in digital technology and how that can improve access, especially as a fourth generation South African, how we can have equitable access in South Africa and how technology can help bridge some of the disparities in our country. So welcome. Thank you very much for your time and for this episode of the podcast. It's great to have you here.
Thank you so
Great to be
much.
here. Thank you.
So we're going to be discussing the Future Health Index reports for South Africa. Now, obviously, there is the global reports, but South Africa is an interesting place because we have a bit of a mix of first world problems and third world problems. So the index reports looked at a number of things. I'm going to come to you first, Mr. Pillay, because this Philips Future Health Index report is now in its 8th year. Why is it important that Philips get involved in this research and in conducting surveys like this?
I think if you look at the trends that came out of the report around sustainability, different modes of care and virtual care, etc., it's important to have this insight and so that we can contribute to this body of knowledge, but at the same time, as a company, prepare better, right, and contribute as well.
Awesome. I love that answer. And then Dr. Khanyile, sorry, I apologize, Dr. Nokukhanya. So as a young healthcare professional yourself, how important is it that the priorities and perspectives of younger healthcare professionals get included in a survey like this?
I think it's very important that as young healthcare professionals, we are going to be the future of healthcare. Yes, the people are making decisions now are very senior, but we don't want to be left with problems that are going to be burdens for us. And also, we have a particular way of doing things. We're tech savvy, we're future looking. We want to make sure that by the time we get to those positions of decision making, we are actively being involved in the process. And that's why I appreciate the fact that Philips took the time to take care of young professionals and their opinions with the survey.
Yeah, I think it's an exciting element of the report this year is that it's also looking at not just bridging the gap in communities and their access to care, but almost like the generation gap in terms of knowledge and the way that you see medicine, because medicine itself is going through rapid transitions from one way of thinking and one way of doing clinical medicine to another way. And technology is an important part of that. This year's index obviously was looking at our perspectives. What really stood out for you, Mr. Pillay, from this year's report?
I think it was encouraging to see that young healthcare professionals as well as healthcare leaders had a common vision of looking at healthcare outcomes being collective, collaborative, and sustainable. And the common view was that technology underpins this. They were also focusing a lot on collaboration and partnerships to get this advancement in technology.
Awesome. And for yourself, Dr. Nokukhanya, what was some of the stuff that stood out?
I think some of the stuff that I really enjoyed was watching how we would compare the opinions between like older leaders and younger leaders, and how with older leaders they were really focused on like AI and how it would contribute to decision making, but the younger guys were worried about things like operational decisions, like on the floor it can be really chaotic. You might not have the support of a consultant on the floor, so how do I communicate the chaos that's happening over the phone, when at least we can have someone who's seeing, okay, these are how many patients you're admitting, this is the level of triaging that they need, do you need more hands on the ground? That's really important as a junior doctor in South Africa, because you don't want to feel like you're drowning.
Absolutely. And on that, and kind of building on that foundation, what stood out for me was the feedback coming from younger professionals that they felt like they weren't equipped to be effective, like their training hadn't actually prepared them well, right? And not only to be trained well and prepared well, to be supported, because it's so important. I mean, I'm an intern doctor. I'm still learning, very much learning as I go. Our professor once joked that we should have an asterisk next to our degree because we were COVID doctors. You know, we trained behind masks. But it's so important that your junior doctors coming through with all of that energy and with all of those fresh perspectives, that they feel like this is a place where they can actually contribute. This is a place where they're going to make a difference. And sometimes it just needs an encouraging word. It needs somebody to say, you know, your perspective actually matters and we're there with you on the ground. Moving on to some of the actual data, you did mention that most healthcare leaders, 95% in fact, would like their healthcare facility to invest in AI technologies in the next 3 years, which is reflected well amongst the young professionals as well, up to 99% of them saying, you know, we want AI, we want this technology that's going to improve clinical practice and the way we do things. This is notably higher than the global averages. What does that say about our South African context? And maybe, Mr. Pillay, you can give your view of what does that mean in South Africa? Why are we more interested than other countries in AI?
I think if you look at our context, right, we have the gap between access to quality healthcare is getting wider and wider. And then you also have a resource constraint, right? So to do more with less, I think, is quite the driving force. So the adoption of technology to do predictive care, whether you're looking at virtual care models, etc. I mean, as an example, in an EICU where we empower, for example, a doctor to look at, or a clinician, a command center, you can view more patients remotely, and then also look at vital signs, etc. across the board. So doing more with less. Yeah. I think the vision and the passion to do more is there clearly. It's just a question of how do we bridge this gap, and using technology becomes an important part. And then AI gives you speed in doing that, right? So that a doctor can build a better care pathway where, for example, the diagnosis is a bit of AI is being used in there to help come to the diagnosis quicker.
Yes, I 100% agree. I think that it's reflecting that there is this sense that we are a little bit behind the eight ball. There's a sense that we could do so much more, and we're feeling the gap because we get to see what's happening in the US a little bit. You know, when we go to conferences or when we log online and we do these Zoom calls, we see what other countries have. And there's that element of like, I want to be there. I want to do more, and AI can help that. What are some of the other effects that can create, and what are some of the other technologies, Dr. Khanyile? I keep on saying Dr. Khanyile.
Dr. Khanyile is fine. I mean, it's still me. It's still me.
But what is it that you think that we see the need to invest in? Because we talk about AI. What are some of the other things that we see the need to invest in?
So I think things like ward management apps and task management apps are really important. And I mean, we've been using some of this in our setting. It enables me as a registrar who's responsible for, on a call, 6 or 7 interns who are in different areas, and they may need help from me. While I'm sitting in the high care area or the admission area, I can then see what has been done, what hasn't been done, and who needs the most urgent help. Yeah. I mean, we use platforms like WhatsApp already. They can send us images, they can send us videos from hospitals that are referring patients over, and we can see that. But there's not really much clinical guidance with regards to that. We can't have feedback to the clinician and the referring clinician if I'm busy, because I then have to do something else. So it's important for us, I think, to invest in things that will help us make decisions, triage those decisions, but also as a senior who's not necessarily with the patient or with the person who's taking care of the patient, I'm able to then help you from where I am. And that's why AI helps with supporting algorithms, helps triaging with supporting decision-making, and also helps us get on the ground and help patients a lot faster.
That's a lovely answer. And I think it's important to point out that using AI doesn't mean that you're just putting in a bunch of symptoms into ChatGPT and hoping that it spits out a diagnosis, right? But actually there's actually tools that will harness what we know about medicine and pool our collective knowledge, because let's be honest, it's impossible to know everything there is about your specialty or about medicine in one go.
No, I'm studying for exams. I know it's impossible to know everything.
And also you mentioned using technologies that we already have. So for example, using WhatsApp and using task management apps like LabTrack and WardWorks and things like that. And I think that that's an important point that was also made at the LinkedIn Live event with Dr. Khanyile-Lenake, where he mentioned that sometimes using technology doesn't mean having the most revolutionary and groundbreaking C-arm from Philips, but rather it can mean using existing technologies, even just having cell phone reminders to tell your patient that this is your date, these are your results, please come with them to the doctor. That can make a difference in communities where maybe knowledge isn't good, maybe access to care isn't good, but cell phone penetration is really, really high. So we're seeing an increased focus on partnerships in this year's report. So it was chapter 3 in the report. So what are some of the ways, Mr. Pillay, what are some of the ways that this looks like in practice for us to partner, especially younger healthcare professionals? What can they partner in? Or what initiatives, what projects are there that we can get involved in to make a difference?
I think the starting point is that in any partnership, the organizations that are coming together, the right KPIs need to be set and priorities. Even whether it's a multinational on one end or an NGO on the other end, and government. I think if you put the patient at the center, then the focus then changes. A good example is in Eastern Cape, where we were focusing on reducing the mother and child death rates, due to the lack of early risk profiling and digitized records, and then subsequently medical legal claims. Having put that together, you had to have a lot of insight on the ground to determine how nurses were working, how the healthcare professionals were working. And then you put a solution in place, but then the KPIs that you had to set had to be done jointly, right? Especially when you have a government entity on the other side. But if you get that right, I think that can work well. Like that, there are many other disease burdens where you can focus on, whether it's oncology or HIV or cardiovascular disease. Many bodies coming together. Some of the forums we facilitate, but some of them we get invited to. I think maybe collectively, if more of us can come together, the OEMs and the government parties, then we can create a better forum for this collaboration, I think.
And I know that as clinicians, we love our abbreviations. So for the benefit of our audience, KPI is key performance
indicators.
Yeah. Not all of us are in business. We have to sometimes think. So I love what you say there, because partnership is, it's also the public and private. And especially as we're going into a country looking at maybe NHI very, very soon, we will see some of those partnerships forced, but hopefully they are agreeable, and they actually, in the case where Philips is advising government, that's an existing relationship that's there. And also partnerships where we're starting to say that as a clinician, you don't only need to think medically. You need to now start thinking wider, because there are lots of people that come into medicine with skills outside and bring a network with them. Right. So one of the key findings of the reports, Dr. Nokukhanya, was talking about that need for partnership, but also having a united front. And Mr. Pillay mentioned that, a united sense of wanting the best for our country, wanting the best for our patients. Has that been your experience, that there's been this kind of united experience of saying we're going to do the best and we're going to find creative ways to do that? Or what are some of the barriers to that?
I think that's the beauty of working in the government sector, is that we have different levels of specialists, from a student to an intern to a registrar who's studying specialist to a specialist to a head of unit who's involved at the administrative and the managerial level. And so you get those different expertise, not just from an evidence-based point of view and clinical point of view, but also just the day-to-day operations of the ward. What are important things you have to consider? those things all play into helping us as junior doctors take those lessons forward while we're still training, so that we're not drowning by the time we have to run our own practices. And I think that's one of the beauties I love about working in the government versus private, because in private you tend to be isolated, you're in silos, and unless you're referring to someone, you don't really get to interact with other healthcare professionals. And so I really understand that with the partnerships that we have, you get to see the beauty of people working really hard, consultants staying with us, resussing with us. One person is counseling the family, the other one is resuscitating, the other one is, doing the actual work of writing notes. We have that teamwork, and everybody then is able to contribute to the healthcare quality, but also make sure that we are learning and teaching one another.
Yeah, that was one of the standouts when I was in pediatrics, was to see the collaborative and teamwork approach that was there, which isn't reflected always in medicine, I must be honest. But that is speaking to the heart of medicine, right? But the best of intentions sometimes falls away when you're faced with infrastructure issues. Definitely. So especially in the public sector, we do have existing infrastructure issues. We do have strain on our system. So what are some of the infrastructure issues that you have faced that could be impeding our progress, and what are the impacts of those limitations in terms of what you can do for your patients? I mean, how do you feel as a clinician where sometimes your hands are tied?
I think the biggest infrastructure issue we find is just bed space. Where do we put the patients that are at various levels of care and requirements of care? You have an ICU that's always full, so we're fighting with another patient, which always sounds weird to me, because I feel like, how do I prioritize one over the other? But we have to make difficult decisions that aren't necessarily going to make me be able to sleep well at night. You also look at just the cleanliness and the structures that we're dealing with. I mean, in pediatrics, we need to have heaters on because in winter it's very cold. So you get hypothermia, so babies who are cold, and now we're having to find extra linen, which isn't there because it's dirty or the cleaning room is not working. So things like that, right? Makes your job a little bit more difficult and adds to the burden. But also, I think the biggest, I wouldn't call it infrastructure, but is the staff itself, because you need people who are on the ground who are actually going to be able to help you do what you do. I always say to my interns, you guys are not just workhorses. I actually need you to think kind of in a way that's going to help me understand your thought process, because then I can help you. If you're just coming to me with an issue, I don't know, are you asking me for this? Are you asking me for that? So kind of help me with that. And that's why we get to be so burnt out, because we're constantly having to help and train over and over and over again. But at the same time, I think with the infrastructure, some of the things that have helped is having different levels of specialists who are able to see and have experience with how to navigate certain things and overcome those infrastructure issues.
I think there's two very important points that jump out from what you've just said. The first being that because of the infrastructure issues, some of the ways that technology is going to shape the future of healthcare in South Africa is just finding creative solutions to those very fundamental problems, such as bed space. So let's take AI, for example, because we mentioned it in the conversation earlier. If you have an AI algorithm that can predict for you when a patient is going to be able to move out of a bed and what the outcomes are going to be if you move them out, so that you can prioritize one patient over the other. That's a very basic example. Another would be that if you could develop a way to solve multiple small problems into one unit, right? So for example, you talk about heating babies, at the same time making sure that they're ventilated, at the same time making sure that their fluid status is monitored, at the same time making sure that their drip is running. If everything can be united into one package, one device or one thing that can handle all of that load, that means that you now have free hands, because now the sister's not endlessly charting what this baby's temperature is, right? The second point that you were speaking about is the human capital aspect, the skills shortage in South Africa, not only because we're struggling to train up enough, but because so many people are leaving South Africa. I loved that Prof. Glenda Gray's statement at the event was, please don't go anywhere. This is a country of opportunity. This is a country that honestly is only going to get better if you stay. And it's important for us to remember that the human aspect is still so important in medicine. AI is not going to take the place of doctors, maybe radiologists.
Don't tell some people that I know that you said that.
The psychiatrists were like, the robots will never replace us. But we also see that healthcare professionals want to work in a place where they feel like they have access to technology, and virtual care is an important element of that. So, Mr. Pillay, as we come to the talk about virtual care and remote patient monitoring, have you seen an increased uptake in this space? I mean, COVID obviously forced that into the space, but now there's ongoing talk about how we can firm up our commitments to telemedicine in South Africa. What are some of the ways that investment is happening there? What are some of the innovations, and how's the landscape going to change in the next few years?
Yeah, I think what I shared also in the LinkedIn forum was that I see all of this technology being pulled right into South Africa because the IP is so high, and we're blessed with that. So those innovations are already being deployed in many scenarios, both public and private. As an example, I mean, you have where you want to get the patient out of ICU as soon as possible to spend fewer days, right? So they go home and then you do remote monitoring. But in order to do that, you may have different devices doing that. And then the technology that links them needs to be interoperable as well. Mm-hmm. So it's something that we work on so that it's vendor agnostic. And then the clinicians or the doctor who's ever collaborating can then use that to do the analysis, etc. But it also, in an ICU that's overburdened, it also helps, right? Because an ICU bed is quite expensive to get patient home. But similarly, in a lot of rural South Africa, a lot of mothers and babies are not getting the scans early, right? Enough. And if you think about the first 1,000 days, I think Africa has the worst stats in terms of the World Health Guidelines.
Yeah.
So if at the moment there are solutions that we've deployed, and some projects are taking a bit longer, but where you can get a scan with a mobile ultrasound out in the field and then have a doctor at maybe one of the second level or tertiary hospitals then do a diagnosis, right? So at least you have an electronic record of the risk profiling, and then if something's concerning, then it can get escalated, right? But then the patient record is already in a digitized form. That project's taking a bit longer, but it's already available. The technology is available as well.
Yes.
And similarly, in many other settings, right, you're finding the virtual care, the predictive care also taking place, where the data from the different devices that's collecting information in particularly radiology, whether it's a CT scan, an MRI, or a cath lab or an X-ray, to then assimilate that data so that the doctor then can spend more time on building a better care pathway versus spending more time in the diagnosis. Yes. So there I see a lot happening. In fact, most of your private radiology and your private hospital groups and public sector, it's already taking place.
I think that's a very important point that you spoke about, out in rural South Africa, because South Africa is a very broad, wide country with spaced out populations. And our experience, especially as junior doctors training in these academic hospitals, sometimes we forget that not all of South Africa is a metro.
Yeah.
And the reality of many South Africans is that they may not see a doctor for weeks. They may not see a doctor for months, or they have to line up for a long time just to see a doctor. And that doctor sometimes isn't able to speak the correct language, So there's all of these other inbuilt problems and difficulties. We spoke about the fact that the technology is there, but we also have the reality of things like load shedding or network outages, where now can we use the technology? So we need to think about multiple problems, not just the problem that we're trying to develop our solutions for. Broadly speaking, I think that we should be using a lot of telemedicine to solve these problems, because instead of a doctor spending 2 hours driving, or let's talk about specialists, because you're going to be one.
Thank you.
So if the nearest specialist is 150 kilometers away, it'll take you an hour and a half to drive that, but it'll take you 5 minutes on a WhatsApp call, right?
Definitely.
So that's one way of spreading out the existing resources, besides moving people out of private and into public.
Yeah.
So when we speaking about like the future of health, we need to talk about all of those like telemedicine things, and we need to speak about the technology. But what else really points to the strong points in the South African health system as it stands, and taking that into the future before we discuss any weaknesses and trying to solve solutions?
I think the strengths of the South African health system is that we are taught early as junior doctors and we're rotating through all the different specialities. So already we have a really broad understanding of medicine. It's different to other systems where, you know, from the time you graduate, you're choosing a specialty and you kind of stay in that. So there's an awareness that we have as junior doctors to other specialties, but also, you know, this one diagnosis might have another aspect to it. Do I need to call another specialist? Do I need to refer to someone else? I think the other thing that's really strong in our healthcare setting is a biopsychosocial approach, because we know that our society doesn't just have medical problems, they have societal problems. We tend to drive a big motivation behind those things. Social workers, allied health professionals, referrals to, schools, etc., that will help our younger people, and as well as our access to grants. Those kinds of things are not just only important to the healthcare, but also the mental and physical well-being of people at home who aren't necessarily ill, but they're living through all of that. And then I think the last thing is understanding and the bigger drive towards mental health, because people are realizing that not just absenteeism because you're ill because of a physical illness, but presenteeism, which is when you're at work but you're burnt out.
Presenteeism.
Yes. And so presenteeism, there was a study done a couple of years ago in South Africa where they showed that presenteeism actually contributes more than 2/3 of the illness compared to absenteeism. So people are at work, but they're not really functional. They're not able to contribute to the meetings. They're not really efficient. So when you understand the biopsychosocial approach, which is what I think is a really good and a strength in our public health system, but also the private health system, because those are the same doctors that are going across there, we start to understand that society in this country, or medicine in this country, is not just medical, it's societal.
Yes. Wow, what a powerful answer. Mr. Pillay, I hope I haven't sent you a hospital pass when I ask for you to speak to some of the strengths in the following an answer like that, some of the strengths in South Africa with our healthcare system.
Yeah, I think the first point is we have lots of strengths. I see it, I mentioned the IP is so high, right? Because I see the level of innovation being pulled by our company and other organizations into the setting. I use this example, when I brought some of my leadership out here from the Middle East, when we went to California, right? A young man there was writing a new front end for PAC system, right? Coding. And then you go across to Sintoke and you see a very green focused hospital and the technology there. We look at all doctors and all clinicians. The one thing, even when I'm dealing with a customer complaint, it's always about the patient. And a doctor who is, I need to treat these patients, the machine needs servicing, etc., etc. It's always about the patient. If it's new technology, it's about, patient outcomes. And those conversations happen all the time. I think one of the key areas you see and witness daily is that I think South African clinicians and healthcare professionals definitely have the patient at the center and want to be able to do that. But then you also see, I consider it a strength, like hospitals like in Limpopo, even Barra as well, now starting to look at environmentally sustainable devices, right? So we're one of the only companies that has helium-free at the 1.5 clinical Tesla standard. And it's just being pulled, even in public sector at the moment, and the demand is something that we can't keep up with at the moment, because they realize the cost of helium, the long-term cost of ownership, but also from an environment perspective.
Yeah. So
I'm happy to see that in both segments, right, private and public. And I mean, clearly another strength is we see it with the key opinion leaders. We have a lot of key opinion leaders in South Africa that contribute to Europe and the US in terms of whether it's cardiovascular, whether it's oncology or any other disease burdens. And it makes quite a big impact, right? And then these feed R&D, then they feed innovation. I mean, we as well benefit from this. I used the example earlier about Red Cross Children's Hospital, and their insight in the way they work with pediatric cardiac patients actually improved the hemodynamic system that we brought to market, and then the whole world benefits from that. Yeah. So, it's quite a lot of strengths.
I think what jumps out for me when I think about healthcare in South Africa is, number one, the investment is there, right? We mentioned it at the LinkedIn event that we are investing as much of our GDP into health as very, very developed nations, you know, Australia, the UK, the US. We are spending money on the public, and that there is a lot of training that goes into that as well, and investment in training. The opportunities we have as young doctors in South Africa are massive. The exposure that we get is massive, to the point where other countries actually pay to send their registrars and consultants just to get a taste of what we as juniors are getting, you know. So that's definitely a plus. I think it's also important that in South Africa, the public still respect doctors. They still respect nurses. There's still a trust there. In many parts of the world, there's a growing distrust of, you know, the healthcare system and people who are working in healthcare. But here in South Africa, people will fall over what the doctor says, you know, like, oh, but the doctor said. And that's a very important part of being able to care for your patients, because they know that you have their best interests at heart. But there are weaknesses. And I think that one of the weaknesses we have is that we do feel that strain of wanting to help patients and wanting the best for them, and not always having the best available. And that was one of the key findings that stood out for me from the reports, is that younger healthcare professionals in South Africa were almost twice as likely as the global average to be disappointed by the availability of technology, right? So in South Africa, it was 1/4 of junior healthcare professionals who were disappointed that technology wasn't readily available to them. And that could be just the video laryngoscopes not working. I don't know. But compared to the global average of 15%, and in Australia it was 8%, and in our colleagues in India, it was 0%, which means that they are actually experiencing as much technology as they expected. So that's one of our weaknesses. What are some of the other weaknesses in our healthcare system that we need to address?
I think it was also interesting for me that I saw that 17% of some of the juniors as well as the seniors in South Africa were concerned about interoperator issues. So for example, me referring a person to radiology, them sending them back, me getting those reports back, me sending someone from a tertiary down, referring to a secondary hospital, you know, trying to follow up with that patient, trying to see what's happening. Even things like simple things like the ambulance service, you know, the delays, and trying to get information about patients and transferring them between areas. I think because of the huge burden that's on the healthcare system, not just in the public, but also the private healthcare system, and there are costs associated, we have difficulties with that, and trying to follow that up can burn you out as a healthcare professional. Another important point that I saw was just about the smoother flow of data between healthcare providers. So what I'm thinking about, if I just think off the top of my head, is me referring a patient to, let's say, a dietitian. That's going to have implications on what I prescribe in terms of feeds. That's going to have implications on what I'm expected in terms of growth, calories, etc. So I want to be able to monitor that. But if the dietitian is, you know, stuck in their clinic and they're not able to come back, and they only have to write a note like a couple of hours later, that's going to then delay ordering of, you know, things like that. So because we are all stuck in various areas and we're being held up by our responsibilities, we're not able to then communicate efficiently. And it's not to say we don't want to communicate, it's that we can't, because we have our own responsibilities in our own areas to be accountable to.
That was an answer that bears insights because of experience, right? You only learn those things from actually working in healthcare. Mr. Pillay, any weaknesses that you've encountered, especially because you've already mentioned you want to be involved in so many levels, from grassroots all the way up. What are some of the weaknesses and challenges that we have in South Africa?
I think also, you know, I said a lot of the doctors are smart, and they pull this technology because they're in touch globally, right? The RSNA, the Europe leg of that, the Arab Health, the Africa Health. So they see the technology available, and it's going to help them be more effective, right? But then when it comes back home, the level of investment, I think, from the survey, and it came out in the answers, they don't see it as enough momentum behind that investment, right? And that's clear. I think that's clearly an area where we can improve. But then also in if you look at just the skills level, right, and the ongoing training and development, etc., I think that's a gap as well. You heard the private health groups recently talking about wanting to train more nurses on their own, but then I think there's a regulatory issue around that, right? So then that makes it challenging. I think the corruption piece doesn't really help. I think you cannot speak about a weakness in South Africa without focusing on that. Is the money being spent on the right initiative, right?
Sure.
Because clearly there's a lot of funds available. The other area I would look at is if you think about NHI and it's premised on universal healthcare coverage. I think we don't have the balance right yet as to where we're going to spend on infrastructure, right? Because the funding model for that, because we have quite significant areas where there are gaps, and we've identified those gaps, but we're not plugging those as quickly as possible, right? And then, learning recently from the GIB session that we were in last week, how important it is to address the other infrastructure concerns in the country around education, particularly job creation, so that an individual can have the right disposable funds to have the right nutrition so that it doesn't end up in hospital.
100%.
So these are, and there you could speak for a very long time on gaps.
Exactly. No, that was something I was going to come to now, because Dr. Nokukhanya mentioned, we have a biopsychosocial approach to medicine in South Africa. And so many times a patient will come for treatment and you've cured them or treated them in the short term. But what made them sick in the first place is a wider social context that you're sending them back out into. So some of those babies that you treat for SAM are going to come back in 6 months' time.
Malnutrition.
Yeah, we can't say that KPI is a difficult abbreviation without mentioning our abbreviations.
Yeah.
So yes, that's the reality. Is that there are problems outside of healthcare that affect healthcare, and healthcare should not be seen as its own thing. We were speaking about NHI. Professor Musa, one of our guests on the podcast, actually mentioned that it's not just about what does the public think about healthcare, what does healthcare think about healthcare, but what does the education department think about healthcare? What does the infrastructure department that's handling your electricity and roads and sewage, what do they think about healthcare? Because all of those things are contributory. Thank you so much for all of your thoughts at this time. I want to give you an opportunity to speak to the future of health in South Africa. Our junior doctors and our medical students that will be listening to this podcast with a keen interest on what is it that they need to change in themselves and what is it that they can do to shape the future of health in South Africa. So what would be your final thoughts or your closing motivation, encouragement, or anything to our junior doctors?
Oh, this is my favorite part. Okay. So I think the most important thing to remember is that you're not alone. Because I feel like sometimes when you're on a call and there's no one around, you need to look to those nurses. Those nurses have years and years of experience. You have seniors who are sometimes covering you, sometimes not, but don't ever feel like you're alone, because there's always going to be someone who's going to help you. And there's a reason you are in internship. You're not a, independent practitioner yet. So reach out to those people around you that are going to give you that information, but also take care of yourself. Take those leave days. Take the leave days guilt-free, because you have them allocated to you. But also, and I think I tell people this on every call, they all know me, just eat. Because there's going to be 30 patients whether you eat or not. But at least you'll be able to be in a better mood, you'll be more relaxed, you'll be in a, more eager state to help them if you've had a little snack. It's going to take you 10 or 15 minutes. Don't do it guiltily. Just take that break for yourself, because you will feel better, you'll feel more refreshed, and then you'll be able to serve your population in a way that also makes you proud, because you also want to do your work with some pride. And I think the last thing is, remember that as the future of South African healthcare, you need to set the standard for the people coming after you.
Very good.
So be the kind of intern you would want to have, because then you know the challenges that you would be facing as an intern now, so that when the guys come after you, you can kind of tell them, okay, yeah, I remember this. I mean, I did Bara as an intern, so I know all the challenges that some of my interns are going through now, and I can help them navigate through it. It also helps to have a mentor, because you're able to then say, this is normal, this is abnormal, kind of have the insight there. And lastly, okay, the last one, I promise. Use resources such as the information that Philips gives you. Use resources such as the evidence-based apps that you have to further your learning on the go. You don't have to study what you're reading, but just reading every time you see acute decompensated heart failure, every time you see that patient, just reading quickly over really helps stimulate that knowledge, because in South Africa, you will see the same problem over and over again, but it's with fresh eyes every time. So you guys are the future of medicine. We are the future of medicine. So let's take our responsibility seriously, and we are definitely going to do this.
Awesome. I love that answer. And yes, it's true. There's so much information out there that's available. And sometimes we can feel a little bit overwhelmed, but you've got to find the high quality information that's out there that you can actually apply to your setting. And it is easier than ever before to do medicine. Let's be honest. You don't have to like a Harrison's Principles of Internal Medicine in your backpack. It's there on your phone. Or you can WhatsApp call, or you can watch a YouTube video, learn how to do a cesarean section via YouTube. But all of those things exist. So the motivation to junior doctors, it's important what you said, is to be excellent, to raise that standard for yourself, because we're never going to have an excellent healthcare system unless the doctors themselves are excellent and holding themselves to a very high standard. Mr. Pillay, sir, what encouragement and motivation do you have for us?
Firstly, I must say amen to what you shared.
Yes, thank you.
I think when I look within my organization, we're blessed with really smart people that really focus and know their content. If I look around me in the country, we're blessed with such a high IP and such a passion, right? I think in healthcare, in many careers, you're looking for purpose to your career, but in healthcare, you're in the business of saving lives, right? And I think people take that passionately. So we already have such a good foundation. So my encouragement and piggybacking of what you shared is to let's harness that better. And I think we can solve so much of our own problems in the country if we just come together in a better platform. But also, I think equally, there's a responsibility on organizations like myself and government entities as well, right? So that we set the right priorities and outcomes for these engagements.
Thank you both for your thoughts. And at that point, we're going to start to wrap up the podcast. But I want to direct our audience to downloading the full Philips Future Health Index reports if you haven't yet already, because there's so many key insights that are there summarized in a nice graphical way for you to see the key information that came out of the survey of more than 3,000 healthcare professionals from 14 countries. And there's lots of insights to take to heart and think, how can I be the difference? How can I contribute to the future of health in South Africa? Thank you very much for appearing on the Dr. Coffee podcast.
Thank you for having us.
Thank you. Glad to be here.
Awesome.